Have you ever had a fear that's so intense it feels like this invisible wall? Something that stops you from doing things you actually want or need to do? Yeah, we're talking about phobias. And today we are diving into a really powerful technology that isn't just helping people face their fears, it's completely changing how we treat them. So, let me just ask you this. What if you could step into a flight simulator, but for your mind? A place where you could practice being courageous, totally safely and effectively, until it just becomes second nature. Well, that is the incredible promise of virtual reality. All right, so here's what we're going to cover. First, we'll break down what we mean by the phobia cage. Then we'll see how VR is unlocking the mind. We're going to look at the hard evidence for 4 really common fears, talk about the crucial difference between a clinical tool and a consumer app, and finally, we'll go over how you can actually access this kind of therapy. Okay, so first things first, let's really define the problem we're talking about here. I mean, we all have fears, right? But a phobia, that is something else entirely. It's not just a dislike or, a moment of anxiety. You see, a phobia is way more than just being scared. It's this intense, persistent dread that makes you avoid things, so much so that it can completely disrupt your life. It becomes this invisible cage that limits where you can go, what you can do, and how you live. And the goal of therapy has always been to find the key to unlock that cage. And that key, it might just be found in technology. So let's talk about this incredible innovation that is helping to unlock the mind, virtual reality exposure therapy. So what is VRET exactly? Well, it's a clinically supervised treatment where a patient puts on a headset and enters this immersive, computer-generated world to safely and gradually face their phobia. That flight simulator analogy is perfect. It's a place to train your brain to handle psychological turbulence. So how does this actually work? Well, it's all based on a process called graded exposure. First, you and a therapist identify your triggers. Then you start with something really mild in VR, like maybe you're just in a room where you know a spider could appear later. As you get comfortable, the therapist gradually dials up the intensity. Over time, your brain literally gets retrained to understand there's no real danger. And that intense, automatic fear response, it just starts to fade away. But you might be wondering, how does this stack up against traditional therapy, where you face your fears in the real world? The absolute key difference is control. In VR, the environment is 100% safe, it's confidential, and it's repeatable. A therapist can summon a thunderstorm or a bumpy flight on demand, which is obviously impossible in real life. And honestly, that feeling of safety and control is often what gives people the courage to take that very first step. Okay, so that's the theory. But the big question is, does it actually work? Let's get into the clinical evidence and see how VRET really performs when facing 4 very, very common phobias. Let's start with acrophobia, the fear of heights. A huge study in the Lancet Psychiatry found that an automated VR program reduced people's fear by an average of 68%. Now get this, the people in the study had lived with their phobia for an average of 30 years. That is absolutely life-changing. Next up, arachnophobia, the fear of spiders. Okay, this is where modern VRT gets incredibly sophisticated. It's not just about seeing a virtual spider anymore. It uses gamification, things like challenges and rewards to keep you engaged. Some of these systems are even neuroadaptive. Imagine this. The program is monitoring your brainwaves and your heart rate, and if it senses your anxiety is spiking, it can automatically dial back the intensity. It's a therapy that literally adapts to you in real time. How cool is that? Okay, what about public speaking anxiety? A major analysis in 2022 compared VRT directly to in-person therapy, and the results, well, they're pretty striking. This chart shows something called effect size, which is basically just a measure of how well a treatment works. And look at those numbers. VRT and traditional therapy are nearly identical. The takeaway here is huge. VRT isn't just a cool gadget. It's a serious clinical tool that performs just as well as the gold standard we've used for decades. And for aerophobia, the fear of flying, it's the exact same principle at work. VRT can simulate everything from the rumble of takeoff to mid-flight turbulence, all while you're perfectly safe in a therapist's office. You can practice that specific moment that triggers your fear over and over again without ever having to buy a plane ticket. This brings us to a really, really important point. With all the consumer VR headsets out there now, like the Quest and others, it is so important to understand that not all virtual reality is therapy.
right? I mean, you can go on any app store and find dozens of apps that claim they'll help you with your fear of heights or public speaking. So how in the world do you tell the difference between a simple wellness tool and an actual, validated medical treatment?
The biggest difference comes down to one thing: a licensed therapist. Clinical VRT is a formal medical treatment. It's guided by a professional, and it's often integrated with other proven techniques like cognitive behavioral therapy or CBT. Those consumer apps, on the other hand, are self-guided. And while some of them might be helpful as a wellness tool, they are absolutely not a substitute for professional therapy. Their quality is just a real mixed bag. So, if you're listening to this and thinking, hey, this might actually be for me, or maybe for someone you know, what are the practical next steps to find qualified help?
And just to be clear, this isn't science fiction. The medical community is taking this very seriously. This quote from the Lancet Psychiatry points out that evidence-based VR could be a game changer for making mental health care way more accessible to way more people.
So where do you begin? Your first stop should always be a licensed mental health professional. You can talk to them about exposure therapy for your phobia and specifically ask if they offer VRT as an option. You can also search directly for clinics that specialize in anxiety disorders because they're often the first ones to adopt these cutting-edge tools. So I want to leave you with this idea. VRT shows us that we can use technology not just to escape reality, but to build a better one inside our own minds, a safe place to practice being brave. So the question I'll leave you with is this: if you could design a reality just to help you heal, where would you begin?